Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist. And in this video, I want to share with you my thoughts on why most meditation actually makes back, butt, and sciatica problems worse. So to illustrate why this happens and my thoughts on it, for anybody who is going to argue with me here, totally cool. But I'm just going to share with you my experience and an actual snippet of a conversation I had with a woman, her name is Amanda, who had suffered with some degree of back, butt, and sciatica problems and was meditating religiously as well as doing yoga and things like that, but just found that it wasn't working. So she had tried lots of different stuff and it just wasn't effective. And so Amanda is now a member of the Glute Relief Accelerator program and has been for the past 2 months. And she has made a massive improvement in just a very short time. And really, this is all by just making one subtle shift in her approach. So she still does meditate, but she does it in a different way. I want to share with you what that looks like and why it wasn't working for her. Now, for those of you who are new to my channel, again, my name is Dr. Charlie Johnson. I'm a physical therapist, and I essentially help teach people all around the world how to resolve their own back, butt, and sciatica problems so that they don't need to rely on other people to fix them or pill shots or surgery. Oh, and real quick, there are so many people out there, and it just kills me to see this, who get hung up on trying to figure out what the heck the cause of their pain is, and they pay lots of money for different diagnostics and tests when really it's all inside of my DIY guide. Okay, so just check it out. I want to help you figure out what's going on for free. There's no catch here. I've laid out all of my algorithms and sort of my whole thought process. You can literally walk through it step by step to figure out, again, the most likely source of your symptoms. So go ahead, download my DIY diagnostic guide if that's something you're interested in. All right, so let's dive into it and let's talk about meditation. So first things first, we're going to define it very briefly. A lot of people probably know, the idea behind meditation, but I just want to take one moment to define it. And then we're going to review the science, right? So what does the science say? Does meditation work for pain relief? We're going to talk about Amanda. I'm going to actually, again, plug in that snippet of the conversation so you can actually see in real time where she sort of went wrong, or how she shifted her approach and how I recommended that she sort of change up the way that she was going about using meditation to try to solve her problem. We're going to chat about actions versus intentions, because as you'll learn in a moment, this is really what it comes down to. You can do the same thing with a different intention and get a different result. So I'll share with you what I mean as it relates to using meditation. We're going to talk about, hey, should you meditate or should you not? And while this comes down to a bit of personal preference, I'll give you my thoughts on this. And then if you should, right, how should you go about doing it? And finally, I want to step back, right? Because a lot of people try these individual tactics. Meditation is just a tactic. It's just a thing that you could do to try to relieve your pain, just like an exercise or a stretch. And there's hundreds of these different inputs that you could try on, again, for pain relief. But at the end of the day, you have to zoom out and say, where does this fit into some process? Because if you're just trying on these individual things, then oftentimes you get confused and lost. And you don't actually know what's working or what's not. So where does this fit into what I call the 4-step pain relief process? All right, so let's dig into this. So let's define meditation. So if you look at this very well mined, all these different places, and you Google things, what is meditation? So meditation can be defined as a set of techniques that are intended to encourage a heightened state of awareness and focus and attention. Now, I thought this was kind of interesting because lots of people define meditation as something you do for relaxation. But this is actually saying, no, you actually heighten your state. And you could argue maybe they're the same thing in a sort of different way, maybe a little bit nuanced there. But meditation can encourage, at least according to these folks, a heightened state of awareness and focused attention. In this definition, I forget where I got this, maybe it's Webster or something like that. Meditation is the act of giving your attention, again, focused attention, to only one thing, either as a religious activity, okay, or as a way of becoming calm and relaxed, right? So this definition is heightened awareness, right? Focus. And this one's saying focus, but be calm. I don't know. So what is meditation? It's a mental exercise. It involves relaxation, focus, and awareness. Seems interesting to me. Meditation is the mind, what physical exercise is the body. This is kind of neat, and we'll talk about this in a bit. Now, here's another thing, verb, right? To focus on one's thoughts, to reflect or ponder was something I saw come up a lot, or think deeply. So, hey, I want you to be relaxed, but just think really deeply and carefully. You could mess this up. Right. So the definitions are all over the place. And obviously there's many, many different types of meditation, right? When I think of meditation, this is what I think of, totally zenning out, sitting in front of a wildflower field or on a rock, whatever, on the beach. And so a lot of people think of meditation and yoga and this Zen word and all this stuff, right? Or in the past, some people, when they were telling me, hey, Charlie, you should check out meditation and stuff, they were find a candle and focus on the flicker. right? So deeply focus on this flicker and just get lost in it, right? So look, there's a million ways that you could do this. So I'm not saying one is right or wrong, but as you can see, it's a little bit all over the place. All right. Now, as it relates to resolving pain, right? Of course, we make everything sound more complicated than it really needs to be. But in medicine, we might, call meditation a component of mindfulness-based stress reduction or mindfulness-based treatment, which often includes some form of like meditation, yoga, relaxation, things like that. All right. So what does the science say about meditation or mindfulness-based stress reduction if meditation is a component of that? So two really cool studies here. One is actually an original study done through 2015 and 2016 when it was published, right? And another you'll see here in a moment was actually a follow-up to this. So they looked at the effect of mindfulness-based stress reduction, as well as cognitive behavioral therapy versus just usual treatment for back pain. All right. And so again, mindfulness-based stress reduction includes some form of meditation as well as yoga and other things. Cognitive behavioral therapy just included some education and basically challenging of the beliefs as it related to their back problems. In this case, the people had chronic back pain. So they did this study, and I'll tell you what they found in a minute. Okay. And the 2-year follow-up then, or almost looks like a year since it was published, but really 2 years since collecting the data, 2-year follow-up was then performed as well. And they sort of compared the results and just reviewed the study. And so when they look back at the initial results and then they did a 2-year follow-up, what they found is that, the first study showed like some modest, but, significant changes in pain. So, if you look at the first study, you'd say, hey, meditation, yoga, these things, they work, right? But the follow-up study 2 years later, right, actually showed that the changes just don't last. So it's like, it's like anything. There's this initial feeling of like hope and maybe an adrenaline rush there, right? That seems to, no matter what you do, reduce pain in the moment. Almost anything can work temporarily. But again, the results don't last. So basically the take home was this: meditation and other mindfulness-based treatments, right, appear to be ineffective at reducing pain long-term, maybe short-term, but not long-term. So if you're going for long-term results, right, then ideally you would find a treatment that works long-term. But why? Like, why does this happen? Why did it work temporarily, right? And why does it seem as though, in my experience, that lots of people come to me with unresolved back, butt, and sciatica problems? They're meditating all day, they're yogis, they're like really kind of zenning out and trying to relax, right? But why is it not working? And why do I feel that maybe the results of the study didn't pan out long-term? So to illustrate why, I want to give you a live example because it's easy to talk theory, right? And I'll review some afterwards, but I want to show you an actual case study of a woman named Amanda. Again, she is now inside the program. She applied for the Glute Relief Accelerator program on the 27th of May. And she booked her call for June 3rd. So this is a snippet of our call that we had just like a couple of months ago as I'm creating this video on June 3rd as it relates to her experience with meditation and how she's been going about doing it. All right, so listen to my thoughts and just pick up on the nuggets as you'll see her husband, Ken, began to.
Well, except that I know that deep breathing helps for a moment or two. I mean, in this instant, what I'm talking about is when I was in hospital just after my accident and I wasn't allowed any more pain relief, I just instinctively resorted to deep breathing and breathing into the pain, which I think is what you were just saying about not running away from it.
Yep, cool.
Right now, it's quite painful, and that's what I'm doing, is to breathe right down into it and release it. But obviously, and so
that's the problem right there. That's your problem.
What
you just said something very important.
Release.
Yeah. If part of this is if this is driven by brain, there's nothing to release.
I mean, release the tension in the muscles.
No, his point is well made. That's a very interesting point you've just made there about, and it supports your approach.
And it's not, by the way, I have no problem talking about the body approach. There's definitely a process we can talk about motion. So just know, like, the program would also involve that. But on the brain side of things, just what Ken said was important. Yeah. What he was thinking. Can you say that? She still looks a little bit like deer in the headlights.
Well, because in the end, there's so much of how pain is perceived and where your mind is going with the pain. You were talking about deep breathing, and then in a way that's a distraction thing from where you are. and you said it helps. But the question is, you have to ask is, what is going on in your mind when you're doing deep breathing?
Well, I'm trying to relax the tension in my muscles.
Yeah, so it is really
yeah. Okay, so just right there, that's kind of it again. You kind of went back to it. But the idea right behind it is that I don't care what happens to your pain. Okay, hold on a second. Let me
So it's how the brain handles the pain.
Yes. Okay, so if you're sitting there, right now, if you're breathing into the pain, you're breathing into it with a purpose. And why are you breathing into your pain? To get it to go away.
Okay, right.
Probably.
So
I don't.
Yeah,
right?
but therefore let the brain go away.
Yeah. So the idea is this, right? It's like, okay, go away, right? But if it doesn't go away, then what happens is you're like, shit, it's not going away, right? If it is driven by the brain, there is nothing wrong with the tissue. And therefore, I don't care if it changes or if it grows or does anything. It's simply your brain making a misinterpretation of it, and we need to retrain it. That's it.
Yeah, it goes back to the psychological behavior approach.
Well, and not even just distraction, just teaching it that like it can be there and it has no meaning.
Yeah, I see what you mean. It's the flight or fright.
Yeah, right now it sets off a trigger.
Yeah.
And you run with it. All right, really cool. So hopefully that was a little bit eye-opening, and maybe you're still like, wait, I don't really get it. But let me explain, all right? And just make this even more clear and kind of like really solidify the thought and the theory behind this, all right? So actions versus intentions, what are they? Are they different, you know? And so look, I want to just define that an intention is the motivation or the reason why that drives our actions, right? It's the driving force behind why we do what we do. And Amanda, right, was meditating with the intent of getting rid of her pain. That's why she was doing it. So, you know, notice how she said, hey, like when I had this surgery a while back, when she had this car accident, right, she started meditating as a way to get rid of her pain or ease her pain because I think she couldn't take pain pills or something like at that time. And so that was her intent. And by trying to breathe through her pain and release it, she actually reinforced and strengthened it. So the harder she tried to get rid of her pain, the more she actually magnetized it or attracted it back. So in Amanda's case, right, her body had fully healed. So this is just a caveat to her case. Her body had actually fully healed, but her brain had been conditioned to experience pain. I'll have to create another video on this as to how we were able to figure that out. But it wasn't actually a structural problem at this point. Her brain had just been conditioned to experience pain because it had been there for so long. It actually learned to experience the pain. So for her, right, there was nothing to release. What she focused on expanded. She was trying to release her muscles, but there was no tight muscle or not to work out. There was no disc that needed to be pushed back in or repaired or press upped, right? There was no piriformis syndrome. It was just that her brain, super smart brain, by the way, had been trained so well to sense danger when there was no longer danger present. So now, look, some people watching this might say, hey, look, so Charlie, like you're telling me that you know, pain was all in her head and she was making it up. And I'm watching this and like, are you telling me my pain can be made up? No. So just calm down for a second. All right. It wasn't. It was very real. All pain is 100% real. All right. But it is an experience. So look, the intention driving her actions of trying to meditate, right? And if meditation one time didn't work, she'd do it multiple times and she'd breathe more through her pain, right? She'd force it, stretch, do Pilates, get hands-on treatment. Everything she was trying was all done with a sense of intensity, pressure, and just urgency to fix the problem. This is key. And this just further placed her brain on high alert and caused her to operate from a place of fear. Now you might say, I'm not afraid of my pain. Call it whatever you want. Fear is just a danger signal, elevates our state. It might be frustration, worry, concern, like I'm annoyed, whatever, right? So as soon as her intentions changed from a place of fear, forcing and fixing, to one of understanding and observing, her pain gradually began to fade away. This might seem crazy, but literally just her intention changed. Right? So again, we chatted with her on June 3rd. And on June 16th, June 17th, right? I had a call with her like on June 15th, I think. She said, I was checking on her. She said, hey, Dr. Charlie, thanks for the nudge. I'm definitely doing better since I stopped actually trying to fix these things, right? And just watch the pain instead. That was the brilliant nugget I gleaned from our call last Friday. It seems as though I'm always trying to fix things throughout my life, not just with pain. And I'm discovering it's not always the best way. Got to let it be. She commented under somebody else's post who, you know, is in the program and said, hey, it's my first week. My pain is worse. What do I do? This isn't working. And she said, yeah, like this happened to me too. Basically, you end up focusing too much on the pain and trying too hard to conquer it. right? And she chatted with me, right, at that point where she also noticed it wasn't working because she was operating under an old paradigm with, faulty intentions. And the nugget I got from the call was to stop trying so hard. So she cut herself back and cut herself some slack, right? And immediately started to feel better. So less is more, right? And this has really helped her in the process. And then she posted another thing, right? Oh, I so agree. This is absolutely true. I'm on a holiday with my family this week and I've not had much time to try at all. And so the less she tried, right, her symptoms were less. So the less she tried, her symptoms, started to feel better. Manny, another guy in the program, which is awesome. He said, hey, just wanted to give a comment based on what I've learned in the past, right? And since I first started the program, the brain is the pain. Now, again, don't take this as you're making this up. For lots of people with unresolved back button sciatica problems, right, we're not actually focusing a lot on fixing the structural problem. We absolutely use medicine, movement as medicine, to try to solve this, all right? But at the end of the day, just recognize that a lot of mindset shifts need to occur in order to help you on your path. So he says the brain is the pain. I knew the brain controls everything, and how we think about it either makes it worse or makes it better. The funny thing is that the more you focus on all the things you need to get rid of it, the more you focus on the pain, the brain makes it worse. Absolutely. So Manny's figuring it out, right? So I learned a while back that if you mentally just get out of your body and just look at yourself and your pain from afar and without judgment, detach, see in detail what is happening, how it's happening, and that's it. That's it, right? You're like, wait, that's it? It's weird, I know, but try it. Without trying to fix or change anything, just observe it. When I joined the program, my leg pain was at an 80. As soon as I realized that the principle applied to pain and brain, I swear it went down a bunch from always hurting to just occasionally. Melissa, really cool nuggets here. Amanda, I 100% agree that focusing too much on your pain is a negative thing. I did this as well the first week and also felt it made things worse. It reminds me of the example of the lady inside the program that had intense headaches, right? As an example, video from phase 1. She tried so hard to do everything right in her life, including intense exercise, eating as healthy as she could, prolonged meditation. I like the point in the lesson. You can be doing all the right things, but if you're doing them with the wrong energy attitude, it's not going to be helpful. So she was doing all this prolonged meditation. This woman inside the program as an example, right? But if you're not doing them with the right intentions, it's not going to be helpful. So she was doing as much as she could out of desperation, trying to control her pain, fix it. It was all fueled by fear and anxiety, right? And the stress that came about trying to solve it. So it's important to realize that staying calm and possibly doing less can be the best approach. Be attentive to your pain, but also remember to engage in life. I like how Dr. Charlie always states, approach the situation with curiosity when trying new tweaks, movement patterns, and or other mental frameworks on. Okay, so really some cool takeaways as Melissa was trying to help Amanda there with some different stuff, all right? So look, when we respond to pain from a place of desperation, when you respond to your pain from a place of attention, fear, frustration, right? It just reinforces that it's dangerous and it persists. It actually gets worse. Trust me. So you can perform the same action, meditation, with different intentions and get different results, right? So should you meditate? So people always want to know. It's like, just tell me, Charlie. Like, I get the theory, but just tell me. Well, hopefully you've learned something so far. But look, meditation alone is highly unlikely, this is based off science, to resolve your symptoms long term. But if you want to do it, and you want to do it because you actually want to do it from a place of understanding, curiosity, you want to explore your symptoms, right? And from a place of joy, not because I'm telling you to do it, but because your doctor's telling you to do it, or because your yoga teacher, practitioner is telling you to do it, right? Then sure, give it a go, but don't force it. Right. And let's go back to this. So meditation is to the mind what physical exercise is to the body. Right. So you have to zoom out and you have to understand where it fits into some big picture. So meditation alone is just one thing. No wonder it doesn't work. Because the first step is you have to optimize the healing environment. You cannot exercise a bad diet. If you want to lose weight, you can run on the treadmill all you want. But if you eat donuts all day, you're not going to get better. You're not going to lose weight. Right. You can do all the treatments. You can meditate for hours. Just like Amanda, right? You can hyper focus on trying to solve this and do lots of different treatments, get lots of different tests and do all this stuff and try really, really hard. But it's just going to lead to exhaustion and burnout. Because if your environment is not conducive to you getting better, all that stuff won't matter. But meditation operates only on one of the fronts. Okay, so when you optimize the healing environment, you need to optimize it physically and mentally. So if you're going to use meditation, you're trying to kind of like change your mindset and do all this stuff, right? By the way, it doesn't do the best job of that, but if you want to try it on, cool, do it. All right. But meditation only tries to optimize the mental environment. Meditation is an exercise for the brain, if you will. So you can do these brain exercises, but if physically you're doing things, right, that continue to perpetuate the problem and just nick the scab physically, habits, routines, the way you move, right, what you do throughout the day, things like that, then the chance of you solving this again is not good. You're only looking at a very small piece of the pie or the equation. It doesn't take into account, it doesn't help you self-assess. You could argue that meditation helps you scan the body, right, mentally, internally, right? But it doesn't actually help you self-assess and objectify your problem. And then you've got mind and movement as medicine. You've got different inputs, different things you can try. Meditation is just one of them. So what is the decision-making logic that you need to learn, right? Does meditation teach you it? No, right? But what is the decision-making logic that you need to learn so that you can figure out exactly what you should be doing and you know is valuable, what is a waste of time and you should just avoid, and or that which is going to make you worse. This is super useful. If you don't understand the logic of what you should be doing and shouldn't be doing, then you're just guessing. And random inputs equal random outputs. All right, you're going to be spending a lot of time there. And then, how to get back to life. So you can meditate, right, on a mountain all you want. Say like, I'm good, I'm good, I'm good, I'm healed, right? But like, if you don't actually like, I'm not afraid of heights, I'm not afraid of pain, but if you don't actually show up and confront it and give yourself credible evidence to believe that's actually true, then you're just fooling yourself and it won't work. All right, so understand that it fits into, it might be a small component if you want to try it. And for Amanda, it was, right? But she had to switch her intentions. And we talked to her about that, just like you saw. But understand where this fits into the bigger picture. All right, and you need to kind of connect the dots there. All right, so that's it. Look, if you want to understand the bigger picture, all right, then what I would urge you to do is just register for a free workshop I've created, Beat Butt Pain. Basically, if you have any type of unresolved back, butt, or sciatic problem, this is perfect for you. And you'll literally, again, see inside my mind as to the process I would use to help people solve this, okay? Also, if you're interested in working with me inside the Glute with Accelerator program, you can do so and apply at the end of that workshop, and or there are links below where you can apply to work with me in the description and probably in the comments. All right, so thanks so much, everyone. That's all I got for now. If this was helpful, just go ahead, hit the subscribe button, as well as the bell for notifications when I post videos whenever I can and however many I can. Thanks so much, everyone. Until next time, ciao soon.